Good morning. Hi, Miss Rube. Every day is definitely different. The beginning kind of starts the same way. What we first do is get a checkout of everyone that's on labor and delivery, antepartum, and postpartum, so we have an idea of what it is that we're covering. All the rooms are full, right?
She has anxiety and just wants to talk to somebody before she goes home because she's really nervous about going home.
You can have her fill out that postpartum Edinburgh.
Okay.
My main responsibility is the OBED. So in the OBED, we see pregnant patients from 16 weeks on and until 6 weeks postpartum. In the OBED, all patients have to be seen by a physician within 30 minutes of their arrival into the bed. Yeah. So this is the physical therapy day. So this is when I want you to really start moving around a little bit. Okay. That basically allows for an OB-specific emergency care, and it also allows us to quickly treat obstetric emergencies like preeclampsia, stroke, postpartum cardiomyopathy, things like that. Well, how many babies is this for y'all? 2. Oh, okay. The second one is always worse. They always say, you know, if you had the second one first, you wouldn't have had the second one. In the OBED, we have one physician who stays in-house 24 hours a day. So where does it hurt? Does it hurt right here? A little lower. The patients that we see, we're basically trying to determine if they can go home. The majority of our patients just go home. We do sometimes have to admit a patient either to labor and delivery or postpartum because they've already had their baby and they're having the postpartum complication. So this just lets us visualize all of the patients that are in labor. So right here we can measure the baby's heart rate, here we can measure the mother's heart rate, and here we can see the contraction pattern. So that just lets us know if there's anything going on. This one patient's having a little decel with a contraction, so she may be getting close. Usually as the baby's head gets compressed, then we start seeing those decels. But for the most part, it's pretty boring right now, which is always a good thing on labor and delivery. I think the whole purpose of the Hospitalist is to improve maternal morbidity and mortality. How have you been eating? Did you eat this morning? I think that's why a lot of hospitals and organizations are going to a Hospitalist. Okay, thanks guys, I appreciate it. Yes, it's scary. It's normal for you to be a little bit afraid, but if we can calm them down and allow them to actually enjoy this experience and make it safer, we need to cut down on the carbs and the sugar. That's a big reward for me. Get the cauliflower rice. That and some Tabasco sauce. Can't tell the difference.